we'll make a start. I'm Dave Bradburn. I'm Director of Public Health in Wirral. I'm also the lead DPH for Child and Family Poverty across Cheshire and Merseyside. A really huge welcome to everyone that joined us for today's session across Cheshire and Merseyside and beyond as well. It's really good to see so many of you here today. And basically, I've had a look at the attendance list earlier. There's a really good wide variety, really good mix of people from local authorities, community, voluntary, faith, social enterprise sector, the NHS, academia, OHID, and then others from outside the region as well, which is really good that people have come here today because you're really interested in improving the opportunities of our most vulnerable families and children. So in terms of just kicking it off, I'm just going to say a few practical housekeeping arrangements. I think there's a little bit on the, it's going to be a few slides there. Just basically, the microphones are muted, but we've got a chat and a Q&A function at the top of your screens. So if you use your chat for things like any comments or any links or anything that you want to draw people's attention to, and then the Q&A, which will use that section for any questions that you've got. We'll look at that later on as the session goes on. And just a note that the session will be recorded so we can share it with you and other colleagues after the event as well. So a really quick plug for the fact that this event is part of the Champs Connect and Learn series. There's an opportunity for people to come together and basically with colleagues across Cheshire and Merseyside and beyond to learn something new and connect with them. So we're allowing Cheshire and Merseyside to strengthen its public health collaborative, improve health outcomes and tackle health inequalities. Alongside this event, there's a whole raft of other CPD events, and they're promoted through the collaborative newsletter, and you can sign up to that on the website. Okay, so in terms of this session then, this is just a little bit of context. You're only going to listen to me for another minute or so. The Cheshire and Merseyside Directors of Public Health and Population Health commissioned a report at the beginning of last year into child and family poverty in the sub-region. That report, which was published in August last year, found that child poverty levels in England and across Cheshire and Merseyside were a serious issue of social injustice. And spoiler alert, it's already on my background here, but we found that over 100,000 children, young people that were under the age of 16 were living in poverty within Cheshire and Merseyside. So the scale of that is definitely a call to action. We hope that this event enables colleagues to understand the current risks, the issues, some of that great work that's taken place across Cheshire and Merseyside. And I've had the pleasure to work with all of today's speakers, and they're all fantastic. So first of all, we're going to have Eustace there, and he'll be talking about the actual situational analysis report that was undertaken. We'll have Elaine, and then we'll have Anna. We'll move on to a very short term, because obviously we've only got an hour for the whole event. We will do the panel Q&As as well, but that's only 10-15 minutes or so, and then I'll close up as well. So we will be away by 2 o'clock. Okay, so without further ado, I'm going to hand over to Eustace, who I've got a brief bio here, but Eustace is a consultant in public health who has worked at local, regional and national levels on health. He's led work on health inequalities, healthy ageing and children and young people. As I mentioned earlier, he produced this situational report on child and family poverty and the framework for action as well. He did that in collaboration with the Altogether Fairer team and the Champs Collaborative. And Eustace is an honorary fellow of the Royal College of Paediatricians and Child Health in recognition for the work he's done in children and young people's health and well-being. So Eustace, over to you. Thank you.
Thanks, Dave. Thanks for the introduction. First slide, please. And a big welcome to you all as well for this event, and great to see such large numbers of people joining. I wanted to start off first by thanking colleagues from across the Cheshire and Merseyside public and voluntary and academic sector for their support in getting our situational analysis completed. We had a working group consisting of those sectors, but also for your continuing support in turning our ambition into a reality for our children and families. This is a major public health concern for all of us, and some of you on the call on this meeting as well, so thank you very much. So why now? As Dave suggested, over a year ago, Directors of Public Health met and were asked to identify the biggest public health concern for them, and unanimously they agreed that it was around child and family poverty. So as Dave says, a report was commissioned, and I led a team to undertake that. But what directors wanted to do was to make sure that we weren't just describing the scale and the size of the problem, but actually we had a plan to move forward to deal with that. So next slide, please. The first thing that we had was the challenge with definitions and obtaining the data that we needed. These are 4 examples of data that have been used in national and international reports. We went for the relative poverty rate before housing costs. Interesting to note, you don't quote me, but it looks likely that the government have intimated online that they might be, when they publish the national strategy, that might be looking at relative poverty after housing costs. Now that's not finalised, but that's something that's come through in some of the coverage of the forthcoming strategy. The other key data here to look at is deep and long-term poverty, and that's poverty where children and families have been in poverty for at least 3 of the last 4 years, and that's a particularly vulnerable group. Next slide, please. So 4 key headline data. There's lots more in the report, which you should already have had the links to, but it will come out to you again later. So the first headline data was that over 100,000 of our children under the age of 16 in Cheshire and Mersey are living in poverty. It was a shocking figure, and it's a real wake-up call to the whole system as a system. The second key data that we found was that whereas we were better than the England average, we've now moved to being worse than the England average. And that's quite important, because I think there sometimes can be an assumption, particularly from outside, that as soon as you lump certain parts of Cheshire and Merseyside together, that actually the rates will fall. And what we found was rates were increasing across our 9 areas. As you all know through a public health lens and looking at data, that actually averages mask significant variation, or can do, and that is the case in child poverty. So we found much higher rates in smaller local areas, but also for particular groups, and that's consistent with with research that's been published nationally and internationally. And the 4th piece of data that we released, which grabbed attention really amongst political leaders and chief execs in particular, was that 6 out of 10 children in low-income households are in working households. This isn't just looking at, when we talk about child poverty, I think sometimes the popular assumption can be that these are all children whose families are living off benefits, and that's clearly not the case. And this figure isn't far off what it is nationally as well. So it's a real wake-up call for us as well around employment issues. Next slide, please. So why should we be fussed and bothered about it? But as you all know on this call, that it's associated with virtually with poor outcomes across virtually every aspect of a child and young person's life. I won't go through the full list, it's extensive, but these are just some of the examples where you can find significant variations between children who live in poverty and their peers who don't. Oral health is a big one, as you all know, and in Cheshire and Merseyside we've got a big campaign supported by the ICB to begin to address that. The other thing that I wanted to highlight is that children can come in and out of poverty because of the changing circumstances of their parents. It can transmit, if you like, from pass on from one generation to another, but it is not inevitable. And we've got thousands of cases across Cheshire and Mersey and across the country where we've been able to break the cycle, but it often requires intervention and support, particularly for families, for parents. And the other impact that child and family poverty has is on the economy. It leads to lower productivity, and it has a massive impact on our local communities. People forced to use food banks and seek other sorts of basic support for daily living. Next slide, please. So what are the main drivers? Well, there are many. There are complex, and they interact with each other. So I won't go through the full list here, but at a macro level, the impact on benefit changes has had a significant impact on child and family poverty. You will have read about this in all the papers, and it's taken greater attention off late as the government prepares its spending review. So the changes to welfare benefits, both in terms of freezing rates, but also making eligibility harder for certain groups of children and families, means that more children and their parents are forced into poverty. We also found locally as well as nationally that the complexity and stigmatization of the benefit system deters a significant number of families from claiming what is legally they're entitled to claim. So even things like free school meals, for example. And at a family level, a household level, we found that issues around long-term worklessness of the parents, parental education and low earnings also has an impact on whether children live in poverty or not. That's not to blame the parents. It describes the situations that people find themselves in, and also really important to stress that it's not inevitable, that there are people who live in these circumstances who, with a range of support and interventions, can exit poverty, and people come in and out of poverty during their lives as well. And access to services continues to be a real pressure, particularly because of the cuts to local government, which has been transmitted onto cuts to services for the voluntary and community sector. Next slide, please. So as well as looking at the data and the national evidence, we carried out a stock take of what was happening across the 9 local authorities and with the ICB. And there's a huge amount of stuff happening at a local and Cheshire and Merseyside level. Each of the 9 have fantastic examples of the impact that they're having on child and family poverty. Each area describes it slightly differently. So some have very specific, like Sefton, have very specific child and family poverty strategies and activities. Others weave it into a wider poverty lens, and others describe it through, for example, the work of their children's services. And a number of others are also planning work and developing further work on child and family poverty as a consequence of us publishing this report. I wanted to give a big shout out as well to 2 sectors that often get ignored in this discussion. One is the role that the voluntary and community sector play, both in providing immediate support, critical daily support to families, but also in their role around advocacy. And hopefully we will see some of the fruits of that advocacy when the government publishes its strategy later this year. And the other group that I wanted to highlight was academic institutions. In Cheshire and Merseyside, we have some of the world-leading institutions looking at child and family poverty, academics who are class-leading and who have helped inform this report and are continuing to support us. Next slide, please. So I said, as well as describing the problem, directors set the challenge of, well, what are we going to do about it? And we developed a framework for action based on evidence from internationally. That framework can help pull people together and focus action. So I won't go through the detail of this, but there are 4 areas. One is around system leadership and advocacy. So we're all united across a common ambition, which I'll come to in a minute, and 3 key priorities. So the first one's about maximising households' income, either through maximising benefit uptake, increasing wages, or reducing the costs that families incur in day-to-day living or going to work and so on, like childcare, housing costs and transport. The second one is to take a life course approach, but to be very targeted in the support that we provide because of the reduced resources that we have as a public sector to those families most in need across the life course. So some obvious ones around Best Start in Life, but also supporting children to achieve their full potential whilst at school. And the third one is for the public sector to use its existing powers through anchor institutions and social value commitments to make sure that when we spend our public money, that actually that money contributes to helping people lift themselves out of poverty. Next slide, please. So where are we now? Well, we're not even a year on from when the report was published at the end of August last year. We have now got agreement across CHAMPS, Directors of Children's Services, the ICB, the voluntary and community sector, that no child in Cheshire and Merseyside lives in poverty. And it has helped to galvanise action at a political level as well. So we have met with all 9 political leaders of the 9 local authorities who've all signed up to this pledge. The ICB have been absolutely fantastic, and through their healthcare partnership have now reoriented the strategy so that anti-poverty work is seen as a major priority. We're working with partners across the system, and indeed across the Northwest, on priority actions, which I'll come on to in a minute. And we've had some very positive engagement with the National Child Poverty Unit in the Cabinet Office. And Dave will give a little announcement at the end of my presentation on how that's moving into a different space as well, which is really positive. Next slide, please. So again, I won't go through the detail here, I haven't got time, but the framework for action, these are our priorities for years 1 and 2. So system leadership, we've got it now in the bag, which is great, that we're united across a shared ambition, and we're working, colleagues like Dave and others on this call, working at a local level, but also with MPs and with political leadership to drive this ambition forward at a strategic level. We've got work across the 3 priorities underway. So we've got work with the DWP and the voluntary and community sector around maximising household income. We're working with the Cheshire and Merseyside Directors of Children's Services Group to look at ways in which we can improve targeted support for families and children in greatest need based on the evidence. And we're currently working with the ICB and the combined authorities and Directors of Regeneration and the Economy to make increased and better use of our anchor and social value opportunities. I don't think we're doing enough in this space. We're doing a lot, but there's a lot more that we can be doing, and that's been acknowledged. Next slide, please. My final slide is why we need a national strategy. As Dave said, I've worked at a national level for many years in Public Health England, and one of the things that we used to advocate for was to have a national strategy. So I'm really delighted that the kind of new government have made a commitment that a national strategy is needed. It's important because it sends a signal across the country that children and families living in poverty are important, that these children matter. It certainly activates political leadership. Dave will testify to this. The meetings that we've had with political leaders has been really important and has galvanised action at a range of different levels, at a local level, but also across Cheshire and Mersey. It also says to the country, and it models it for local government, that actually child poverty doesn't sit just in one department. It doesn't just sit in the benefit system in DWP. It doesn't just sit in health. It sits across every part of national government. And that's really important that that's played out at a local level. And one of the challenges we found in the report is that we don't always make best use of what's happening in each local government department to have an impact on child and family poverty. We need to maximise that. And the second one, the last one is that we're hoping, fingers crossed, that there will be new resources and more effective use of existing resources when the strategy is finally published. The announcement has been made that it will be delayed. It was supposed to be spring of this year. It's going to be sometime later this year, I think no earlier than autumn. My personal view, having worked at a national level and with ministers previously, with different set of ministers, is I'd rather that the strategy comes out later, but is what we need, rather than something that's rushed to meet a deadline and more of a tick box exercise. So really positive that the government continues to be engaging with communities, with organisations at a national and local level to deliver the national strategy. I'll hand over to Dave, who's just got a little update as well on that. Thank you.
Okay, Eustace, thank you. Yeah, so, I mean, amazing presentation, really, really good work. It reflects a lot of the excellent work that's already taken place at local and regional levels as well. I think on the back of that, last week we were just contacted basically that they're interested in coming to do a ministerial visit to Cheshire and Merseyside. That is probably going to be sometime during July. We're just in the process of making those arrangements, and we'll keep relevant partners up to date with that as it progresses as well. But yeah, so such really good interest, and helps us to be able to inform and shape some of that national policy as well. Anything else you wanted to say on that, Eustace? No? Okay, lovely. Thank you very much again. Okay, so quickly moving on, because I know time is tight. We've got Elaine Bentley next, who's Head of Service for Early Help in Warrington Borough Council. Elaine oversees the development and implementation of evidence-based programmes addressing issues early on in children, young people's and families' lives. She leads a multidisciplinary division of skilled professionals to provide universal, targeted support and resources to individuals and families before more serious issues develop. So I'm going to hand over to Elaine. Over to you.
Thank you, Dave, and welcome everyone. I think, after hearing that really doom and gloom story, I think it's really important to balance some of that out to some of the fantastic work that's going on across the sub-region as well. So obviously today I want to talk about how Children's Services provide very timely interventions and targeted interventions for children, young people and families to prevent some of these issues escalating and worsening across the sub-region. So if you just go to my next slide, please. Yeah, the one after that, please. Thank you. Okay, so I just wanted to give you a little bit of a flavour, really, because this is one of the key national programmes and drivers, really, that supports us getting out of poverty and supporting those families that are suffering, unfortunately. I'm obviously going to talk a little bit more about Warrington, where I'm based, but I wanted to just say that my peers across the sub-region are doing an amazing job of working with the children and families, and we meet every quarter to discuss actually how our national programmes working. Out of the 9 local authorities, 7 got the funding to support the Best Start family hubs. And 2 of us didn't, and one of those local authorities got transformation fund. The 2 that didn't get any money was Cheshire West and Chester and Warrington. But it's really important that we're still here to showcase actually the amazing work we do across the board. Now we get together as well quarterly on a Best Start Family Hub partnership group, where we discuss best practice models of what works, because it just sometimes doesn't always need money. It just needs that goodwill and that buy-in, and that how we can work more efficiently together. Just to give you a flavour, for in Liverpool, they've launched 5 family hubs. Warrington, that's our first, which you can see on this first slide. In Cheshire East, they've launched 2. In Holton, 4. In Knowsley, 1. In Sefton, they've launched 3. In Wirral, a massive 12 family hubs. St Helens have launched 3, and Cheshire West and Chester are launching them very, very soon. People know that family hubs obviously a crucial one-stop shop really for our families. We want it to be a single front door where they can access all our services. As you can see, they offer financial advice, parenting, mental health support, but we can't do it without our partners. So it's crucial that council, health and community partners all work together to make sure we're bringing these local services together, and that we handhold our families and connect to other partners. Then we're not turning anybody away. Once they walk through our doors, they get the support that they need. Okay, next slide, please. Some of the root causes you'll already know about child poverty. Economic, obviously, inequality, about sometimes low wages, lack of wealth distribution, unemployment, etc. It's really difficult. There's also poor housing conditions, the lack of access to education. Parents sometimes have got very limited education, often have fewer than job opportunities, and obviously some children in poverty suffer from getting access to quality education as well. Weak social safety nets I've put there. That's obviously sometimes inadequate support from the government regarding benefits, which doesn't help, and obviously discrimination and social inclusion, again based on race, gender, ethnicity, disability, etc., all sometimes contribute to the causes of child poverty. Some of the family structure and stabilities, again, we have a lot of single parents, but then we also have very large families who also can be suffering from child poverty, and making sure they get the right housing and support as well to make sure we meet their basic needs. Regarding health and nutrition, again, another root cause, poor accessibility to health, obviously chronic illness with some families and parents that we're working with, and basically educating them on what nutrition looks like, especially around school readiness, and making sure that we provide the right support for families regarding cooking skills, etc., cooking sessions on a healthy budget. Okay, next slide, please. I'm just going to share with you some, and this is not an exhaustive list. This is providing some practical support that we do now in Warrington and across the borough, and also from our Cheshire and Merseyside partners as well. One of the biggest ones is the Holiday Activity and Food Programme, which I lead within Warrington, and how that supports not just children that are on free school meals, but our most vulnerable children as well. We have a percentage budget for the holiday food programme to make sure we meet our most vulnerable. Breakfast clubs and education settings, again, it's the ambition for school readiness, and the breakfast clubs have brought some challenge as well, but it's making sure that we can have all this wraparound support for our children. The bread and butter thing is obviously something we have in a family hub that obviously parents and children and adults can just come and get some food. We have a DWP officer and CAB that support families based in family hubs. So again, anything to do with family work, they're there to support with benefits, providing food bank vouchers. We have a swap shop. So if people want to bring in clothes that no longer fit and can take other clothes, we have a lot of swap shop like that. Coffee mornings, we have housing and guest speakers there, so parents can listen and still come to the same hub. They don't have to keep travelling across the borough or city. Uniform stop, early essentials, and we have Care UK as well that help with white goods. And then obviously a lot of work we've been doing at the minute is oral health, about toothbrushing packages in all family hubs. So lots of deliveries have been happening, and we've been able to give them all our families that are engaging with children's services across local authorities, education, social care. Thank you. Next slide, please. Which again is just, I think it's really good. I know when Eustace were talking, sometimes it's a bit of a doom and gloom picture, but I really want to celebrate the amount of work that ourselves in local authorities and partners and the voluntary sector are doing to support and mitigate some of these factors. Again, hampers, we make sure we give hampers out at Christmas, and I've put in their whole family working, because basically a lot of our ambition across the Cheshire and Merseyside is that we work with a lot of families and whole family households. And people do think that sometimes children that are living in poverty should look like they're neglectful, and that's not the case. So it's really important. I've just put GCP2 there. That's a tool to measure neglect. Regardless of that, it's important that we see children for who they are and support where we can. For young people within family hubs, because we work from a 0 to 1925, we've been already investing in cooking sessions for our youth, making sure they can cook on a budget. Some safer sleep, energy grants. We give sanitary products out for free, baby products, nappies, wipes, prams, Moses baskets, etc. in all the family hubs. And then part of our targeted intervention, we make sure we support with budgeting, parenting, family support, debt management, tobacco management and gambling, which again is coming across some of our most complex families. Okay, next slide. So some of the improving education outcomes and reducing disparities, we've done a lot of work at the minute with education disparities as well in Warrington. And basically we've got 12 recommendations that are forming a multi-agency action plan going forward. And obviously I've put some things there we've been doing. Best Start for Life, making sure our communication, speech and language is key, because those people that work like myself in 0 to 19, we know that within youth justice, a lot of their areas of support is needed across speech and language, and that is our youth custody. Work with schools to support attendance and engagement. The EPSA work that we do, which is very innovative, provide family learning opportunities and home learning environment. We're back in our family hubs, and we do evidence-based parenting programs Not always parents can go on an evidence-based parenting programme, so we make sure for those parents we do that one-to-one and provide them with that capacity. This all helps break the cycle of poverty by improving the long-term educational attainment. Okay, next slide, please. Just sharing, and again, this is not exhaustive, some of the coordinated multi-agency support that is already ongoing. Again, I've just mentioned in our family hubs, and this differs right across the sub-region. We have maternity services in there daily, our health partners, our 0 to 19 services help in there daily. CAB may come a couple of times a week, but we have lots more partners coming into family hubs. The team around the school is really important, so we put support around the school and the child that attends that school. What we've just recently set up is quite innovative within Warrington is our young carers group. So CQC inspections are starting to ask more questions about young carers and adult carers. And also for our ILAC inspections for children's, it's really important that we identify who our young carers are, because actually some of these are caring, sometimes inappropriately for their parent carers or for their siblings. And it's making sure we give that wraparound support to that. So that's really useful at the minute that we've got loads of partners around the table for that. And there's a no wrong door memorandum of understanding that's come out to talk that ICB, councils and adult social care can sign up for that. Our Families First for Children, we know, is our reforms for children's social care, and that's really going well within the North West. And our 2 Cheshire and Merseyside local authorities is Warrington and Wirral, that are the pathfinders for our Families First for Children that are doing really well. And I know there was a big conference in St Helens. Hopefully people did attend that to show you actually how that's working and where we're tweaking our support. And basically the ambition is early intervention is the most key and less costly work that needs to be done. And I know there's lots of people on this call that really are passionate and driving that agenda. We have a hard to house panel. Again, that's about early intervention, making sure families are not stuck in the wrong housing, overcrowdedness, damp, and looking at how we can support with a wraparound support of children's services, adult services, etc., and the voluntary sector. Then we have a baby zone within our Warrington Youth Zone, which is partnership with Home Start and our amazing volunteers that work with children 0 to 5. And again, our Best Start and Family Hub steering groups that we have across Cheshire and Merseyside. Okay, next slide. So my last slide, it's just really about something that Eustace said about some of our families. We don't think they're in poverty. They are, they don't need to be on benefits. We are trying to empower families to stay out of poverty, but also not to depend too much on services. So it's empowering the families in poverty requires that multifaceted, sustainable approach that addresses both immediate and long-term systemic barriers. So we support parents with skills and confidence, we promote independence, strength-based practice, and all our workers across the sub-region are trauma-informed and trauma-trained. We have lots of trauma trainers now across the sub-region, how we can make sure we write to the child and show them how we can support their parents. We support community connections and peer networks. So the example of one there that's supporting our neurodiverse families, and you'll have your Warrington parents and carers or parents and carers forums across your sub-region that can also empower families. It's really important that to empower our design of services and deliver it is that we get the voice of the child and family, and they need to tell us what we need to do differently. We support that by making sure we get their voice at the end of any intervention. We invite them to our meetings, and we do a lot of co-production work with our children and families, especially youth. Again, I think it was already mentioned about the advocacy support that Eustace mentioned about some amazing work being done by our community partners. And we do that as family support. We write documents for families. If it's to get white goods, uniforms, etc., we make sure we support them with those documents. And then lastly, to provide that rapid rehousing and eviction prevention and some tenant legal aid as well that we make sure we put in place. So that's me finished. Again, that's not exhaustive. There's lots more work being done across children's services, but I just wanted to give you a flavour of what's already happening. And thank you.
Thank you, Elaine. That was really, really good. Really good. A whole massive range of stuff that you covering obviously what's going on in Warrington, but you did also comment on some of the other work that's going on beyond that as well. So excellent presentation, thanks. So just a quick reminder, any questions, we're going to take them after this next slot now. So if you want to think of a few and put them in the Q&A tab, that would be really good. So I'm going to introduce Anna now, who's Head of Inequalities and Strategic Partnerships in Sefton Borough Council. So Anna leads on health improvement, weight management, child poverty and communities, and is the lead for All Together Fairer for Sefton. So Anna's involved in consultation and engagement with local people and professionals, and ensures that social determinants are rooted in Sefton's approach to health and wellbeing. So I'm going to hand over to Anna.
Thanks, Dave. Right, apologies if I sound like I'm galloping past on a horse for this presentation, but there's an awful lot going on in Sefton. So I'm just going to give you a complete snapshot of the journey, really, which is aligned to the situational analysis, which was introduced earlier by Eustace. So if you could go to next slide, please. Next slide again, thank you. So what I'd like to do is get straight into the recommendations that came from that situational analysis. And I'd like to take each one individually, really to give you some reflection on how we have actually applied those recommendations, which has been a really good exercise for me to do, because we've been doing this since 2022. So this has also allowed me to have some reflective practice, one on the recommendations that this report has come out with, and also we were audited by the LGA in terms of the approach, which we were really pleased with the final assessment, which again was very much related to these recommendations that have come out of the analysis. So if we look at the first one, set an ambition on child poverty and articulate widely, if you'd like to go to the next slide. Thank you. We made this very clear at the beginning. As Dave said earlier, we have actually got a dedicated strategy, and we looked at that ambition and divided that, if you like, into 3 core areas. So we've got pockets, which is about maximising financial resources of low-income families, and that's now. What can we actually do now? The prospects is very much about lifting those and improving those life chances of children in poverty. And that, again, I can come on to that in more detail in a minute. And the final one is about those creating connected, inclusive environments that everybody can enjoy the good things in life. Next slide, please. So these really summarises the big wins, what we're developing and how we can drive our efforts with a very clear action-focused approach against the pockets, prospects and places. And within each of those areas, there is a really well-defined performance framework and action plan aligned to it, which brings me on to the next slide, please. And that was about the governance and oversight system, again, the second recommendation. Now, that strategy I talked about at the beginning was rooted in a full needs assessment and an evidence review and a very lengthy consultation and engagement process. We did a lot of research, and from that underpinned the plan of action and the priority setting around the 3 Ps. We recognised as well that this could not just be a public health focus. This had to be everybody's business. And we made sure that within the governance structure, we wanted a multi-agency group, which would be the key steering group, not a public health group, but again, everybody's business. And we had that chaired by the executive director, who's still doing it now. And that exec director is Director of Operations and Partnerships. So we felt that that group itself could be accountable to our Children's Partnership Board and then in turn to the Health and Wellbeing Board. So aligned to that, we have regular meetings, about 30 odd people attend from across the whole partnership, and that has a progress and accountability framework attached to it. We encourage full performance monitoring within the group, and there's also an internal and external communications plan as well. So if you move on to the next slide, this is about setting the plan and having the capacity to implement. absolutely critical. So within that, I would say the timeliness of the Altogether Fairer programme was so serendipitous for us. Really good, because the key thing in that was, because Altogether Fairer and the 8 principles took this very broad social determinants approach, it allowed us to bring in the building blocks of health as the narrative, so people could connect with it. They understood that whole thing about child poverty, what that meant in the context of the building blocks of health through the social determinants approach became obvious and visible. That then created, if you like, a collective solidarity, so that we have this ownership and everyone started to see their part in it. And we were supporting people to show big examples of where local actions could make a big contribution to making change. So this whole thing about this widespread understanding of the social determinants of health and how that actually applies in the work that I do, the job I'm doing, was a really good way of us having capacity to implement, to make sure it became everybody's business. So next slide, please. So this is very much about adopting that framework and how we could actually monitor and drive the action. Now, on the right here, you'll see facts and figures, absolutely critical. Milestones, so important to be able to move this forward, but very much, again, the show and tell approach. We've had 3 major conferences with over 100 delegates from right across the board, and bringing it to life with meaningful narrative and conversation, not just the numbers. What does it mean at a local level? And that has enabled us to actually adopt a real living framework for us to be able to say, this is what we want to do, this is how we're going to monitor it, and this is how we're going to continue to drive it. So that show and tell has been really important in doing that, and also being able to bring in lived experience as we're doing it. Next slide, please. Now, again, we haven't got time to go into real detail here, but I've put this on the screen, so I'm hoping you can just have a quick look at the breadth. What I want to do here is show you the actual breadth of who we work with, the number of partners, and how that applies across children and young people, across the VCF, care experienced, employment and skills, all of this areas, and creating programs and the support now, actionable stuff that we could do now, really tackling these pockets of sticky deprivation. Next slide, please. And again, this is for prospects. I just want to bring out a couple of here. If you look at one of the things here is our e-learning program we've set about for everybody to be able to use now on tackling child poverty, supporting staff to do that. We've commissioned Children's North East, who are very, very experienced and skilled in poverty proofing, and we have brought in a lot of our schools to be able to do sessions where teachers, staff right the way through in our education sector understand what poverty proofing the school day actually means. We have within this our corporate parenting team, Mersey Care, the Caring Business Charter. So all of these areas are massively focused on building prospects and tackling hidden poverty. Next slide, places. Thanks. This is the last slide in the show and tell I just wanted to go through. Again, this was very broad. We've had our housing providers in who we've been working with to be able to support healthy places. Again, that poverty proofing I mentioned is not just an education. We're doing a piece of work which is at a research phase at the moment, but looking at, in terms of arts and culture, is it feasible for young people to get involved in arts and culture when a lot of the time it's quite prohibitive in terms of cost? So what can we do to actually say, yeah, that'll be brilliant, come into a Van Gogh installation, but it's only going to cost you 45 quid. How can we get across that and tackle that so that not only are people not stopping it at the first base, but they're also seeing what is their part in arts and culture? We're also looking at our vaping services, oral health and poverty initiatives are there. So again, the breadth of this, there's lots going on within each of these, and I'd be very happy to talk in any detail beyond this. But I just wanted to give you a broader idea of how far reaching this is. So next slide, please. So on this slide, this really just is from my final slide, but what I wanted to focus on this is, this has very much been an approach, has been a collective approach to bring a strategy to life. We didn't want at the beginning to write a strategy and leave it on a shelf somewhere. It's about everybody's business. And within that, I said earlier, the Altogether Fairer programme was so timely in using the social determinants as the building blocks of health to really create that collective understanding of what's your role in developing this and bringing it alive. So I would say that this whole situational analysis that we have now, it's been so good to do, because we think, although our plan was, we thought we were doing the right thing by using everything we're very skilled and experienced in, but this has actually endorsed the fact that looking at those 4 recommendations and the work we did with the LGA, we think we have taken the right route, if you like, and it's given us an awful lot of confidence in terms of what we're doing, to carry on doing and to be doing a lot more of it together. So that would probably be the summary of how we have applied this collectively in Sefton. That's me done. I hope I've caught up time here, 10 minutes.
That's excellent, Anna. Thank you again for sharing that, Sefton's experience of that. Again, it's a really good structured approach that you've outlined there, and I'm sure many of us from other areas are looking at that, recognising elements of it. But it's great to see it all together as one package, definitely. So, right, we are going to move into Q&A session. We've got less than 10 minutes, but if members of the panel can be ready to deal with any of these. I'm just going to, there aren't that many in the actual Q&A that I can see at the moment, but there's one here which Ben submitted very early on, which was around, there is much needed local, regional and national advocacy work going on. How can we strengthen this further by joining up our influencing and voice between sectors and leaders? So, Eustace, with your various hats on at different levels, do you want to come in and have a go at answering that one first?
Yeah, thanks, and thanks, Ben. That's a great question. So I think this is at 2 levels, really. So one is at a local level, local authority area level, and a lot of that's happening through the various structures that you have at a local level, through the Health and Wellbeing Board, through formal partnerships, through focused pieces of work on child and family poverty in areas that affect that, like, for example, the work that Elaine described around family support. So I think that's at one level. At a Cheshire and Merseyside level, one of the things that we've been doing is working with the sector at a C&M level to try and drive forward things in a more systematic way. So we've just had an assembly with the voluntary sector 6 for Liverpool City region, and we're hoping to replicate that for Cheshire and Cheshire and Warrington as well. And the plan is that meeting, that assembly, will provide a springboard for coordinated action at an LCR level. The healthcare partnerships also pulling together key partners across the voluntary and community sector so that we can act as one where that's the right thing to do.
Oh, sorry. Thank you, Eustace. Anna, do you want to come in at all, or Elaine? Do you want to add anything, or are you happy with what's been said so far?
Yeah, happy with Eustace's response.
Yeah,
okay.
Yeah, I agree.
Lovely. Okay, right. I'm trying to multitask here now because I'm getting emails of questions and the ones that are in the question and answer as well. But in the Q&A section, there's one from Gus Keynes, MBE, and he says that how will the government changes to being work ready for keeping disability benefits to affect child poverty? So that's quite a challenging question at this moment in time in terms of understanding the impact of that. I don't know if anyone is aware of any impact assessments that have been undertaken on that so far. I am not. I can see that could have pros and cons attached to it, but I think more work needs to be done on monitoring how much of an impact that would have, because obviously getting people into work is a positive in its own right, but at what expense? It would be the question there for me. But does anybody else want to come in and answer that, Eustace?
Yeah, just very quickly, Dave. So there's been some independent assessment of the impact, as well as assessments by organisations like Child Poverty Action Group and the CAB nationally, and the numbers are stark. We haven't got time to go through them, but one estimate that I saw was that in the next 5 years, at least another 50,000 children could end up in poverty as a result of these changes. And bear in mind, these changes are cumulative. They're building on changes that I described, Elaine and I described earlier, where the benefit system entitlements have been reduced and rates have been frozen as well. So, you know, it already builds on a very challenging position for anyone who has to rely on benefits.
Yeah, no, thank you, Eustace. Okay, I'm just picking up some of these now that have come in through email route. So there's one here. How do we ensure that families and young people, volunteers and people working on the front line are involved in and central to shaping the responses and approaches to tackling child poverty? So I think that's something that Anna definitely mentioned within yours, and I'll come Anna, Elaine, and then Eustace on this one.
Yeah, it's a really good question, and I think it's an absolutely critical question too. All of the research we did, it took us a long while to actually get out and have some independent, impartial kind of research and consultation done. And even now, whenever we're doing anything that might be new or an intervention or whatever, again, it's rooted in not what we think, but what is required. And also the fact that we might have had it 2 years ago, often we need to look at redesign a lot of the time. We've taken on, for example, one of our programs is a respiratory pilot. It's now a program. It was a pilot. And we let that run for a year, but it's been successful, and it's something that we do want to continue. That will constantly be reviewed, not by thinking that we need to change it, but again, by levels of consultation. So central, left, right, centre, that you have to design your services around what is required by that consultation. Does that answer the question? Sorry.
Yes, yeah. No, that's great. Thanks. Go on, Elaine. Anything to add on that?
Yeah, please. And great question, Sharon. And I think we can do this a little bit better. Is the co-production with lived experience families regarding that are already tackling child poverty, and we're introducing them more and more. Sometimes they don't want to be physical within physical meetings, and that's fine. But then we've done more co-production by going out to families, listening to their stories, asking them how we shape our services, a bit like what Anna's just touched on. And we're doing a lot more with young people, which is our next generation as well, our young carers, like I mentioned before. But we need to do more about how we deliver our services. What do they want our templates to look like? How are they understanding what we're doing? We're always wanting to get the outcomes. And yes, sometimes it's a test and learn as well. But I think we need just to get those people with lived experience and their stories told more within a forum, because it's more powerful, and we change our service delivery that suits the majority of those people.
Thanks, Elaine. Eustace, anything to add?
No, just really echo Elaine's last point there, really important point.
Yeah, okay. Coming to the last question. Oh God, that's a tricky one. Who's asking these questions? So this is another about the impact. What impact will the changes to the ICB have on child and family poverty work in Cheshire and Merseyside? That is a really tough one again to ask. We know that colleagues in ICB, the health world as well, going through a difficult time in terms of some of those budget restrictions, along with many areas beyond the NHS as well. I think local authorities and other public sector and the voluntary community sector, we've all been experiencing those cuts and those shrinking resources. I think for me, it says here, suggested Dave Eustace to answer this one. So I'm giving a little bit of a response to it. I think I know we shouldn't have to, but I think we've got well used to those shrinking resources and that ability to keep as strong and resilient as we can when we're fighting those, looking after each other across the system as much as possible. That strong partnership working, that relationships that we've got, making sure that our community voluntary sector are still there and are key and important to us in that work. That when we turn to them to do a lot of this work, that they're actually still there. I think that's key to me. So there's some of the key messages that I am certainly trying to make representation to as we go forward. So yeah, it's just a case of I haven't seen the impact of that yet. I think it's unclear in terms of what the specific question is asking about the ICB changes, but that is something that we will be looking at closely with our local ICB in particular, but having national conversations as well in terms of that. So Eustace, it also says Dave stroke Eustace for this. So anything further?
No, we've had such great support from the ICB leadership at all levels. So I can't see that disappearing. I don't think that will change. It's just the issue of the capacity for the system to drive forward in the way that we need it to.
Yeah. Okay, brilliant. Okay, I am bearing in mind time. I am going to wind up now because it's going to take me 2 minutes to just wind up. So I hope you have found that really beneficial. The Q&As, if you've got any other Q&As that you haven't had answered, please send them in and we'll get answers out to people. Hopefully you found it beneficial, the opportunity to hear about some of that work that's gone on locally around the child and poverty situational analysis and the local work that's already going on. I think I'd just like to encourage people to first of all fill in the evaluation form, which will be in the link in the chat. Many of you are already heavily involved in developing and delivering this work, so I think that's really, really positive that we've got so many people who are interested in this. All the conversations that we've had have been really, really positive in terms of people wanting to get into this space and recognizing that they're already contributing, but there's other things that they can do. They can connect it better. They can share their examples of good work going forward. So if you're able to, please, it would be really helpful. If there is one thing that you're going to do following this session, if you could just put that into the chat, I think that would be really good, and we'll capture that in the report for today. We'll record we're sharing the recording and the resources and the slides with you all after the event. Don't forget to keep engaged with the CPD opportunities that we'll have available via the newsletter and Collaborate. Again, massive thanks to all the contributors today and everyone who's in the background that maybe you're not even seeing that have been involved in making those arrangements and making it a slick operation ish. Apologies if I've not done that bit so well, but anyway, so that real call to action for us to ensure that no children grow up in poverty within Cheshire and Merseyside. That's what we're trying to do, and we'll bring that together. Hopefully this event will have at least sparked something that you'll then be able to recognise that you can do further, even if it's connecting with somebody else or something about this work. I hope you've enjoyed it, and I'm going to close the event. Thank you all very much for your attendance, and we look forward to working with you more over the coming years. Thank you.